One of the challenges of practicing medicine is performing a good yet efficient physical exam. So today I'm going to show you how I do my physical exam for low back and lower extremity pain. My name is Dr. Ammon Hills. I'm a pain management physician practicing in northern Utah. My purpose as a doctor is to help relieve pain and suffering while also improving function and helping patients get their lives back. Today I'm focusing on the physical exam, which can be helpful both for patients to know what to expect when visiting the doctor's office and also for healthcare providers to do things efficiently and know what's going on. The first thing we're going to do is observe how they walk to see if they're limping, is it painful, what other abnormalities are there. During this part, we also ask the patient to walk on their heels and on their toes. This helps us know not only their coordination, but also their strength. We have to be careful though, because some patients have a fall risk and may not have the greatest balance. And so I'm always there to help support the patient during this process. The next thing we're gonna do now that the patient is standing, we're gonna test their range of motion of their low back. We're gonna do this by have them bending forward, like they're gonna touch their toes, and then coming up, extending their back this way and rotating side to side. So depending where they have pain during this range of motion exercise will help us figure out where this pain may be coming from. For example, if they're leaning forward, that may be putting more pressure on their discs in the spine, and which may be a cause of their low back pain. But if their pain is more when they're coming back and twisting side to side, that may be putting more pressure on the joints in the low back, which is common when people have arthritis in the low back. So then we'll have the patient get up on the physical exam table in a sitting position. So during this part, we're also looking or inspecting for different abnormalities that may be present. So at this point, we're gonna start to palpate or feel different areas along the low back and hip area to see if that reproduces any of the pain. Next, we're gonna check to see if they have any decreased sensation to light touch, and sometimes we'll also do decreased sensation to like a pinprick. The reason we do this is there's different sensory fibers that carry this information from our periphery, from the legs, up to our brain. We're also gonna test muscle strength testing, which is really important. That can help us know if there's a nerve that's getting a little bit squished, either in the lower extremities or even in the back. We're also going to test reflexes, which is important, that can help us know if there's any nerves going from the periphery up to our spine that may be a little bit squished. Next, we're going to have the patient lay on their back, and then we're going to do range of motion of the lower extremities and some other special tests. There's a lot of different special tests to help us figure out where the pain may be coming from, and at times this may be a little overwhelming as a provider, knowing which tests to do and in the amount of time that we have. We do things in the same sequence so that we can be efficient while also remembering to do all of the appropriate tests. When we're doing these tests, I specify if they are having pain, we need to know where that pain's coming from, because sometimes we can do the same maneuver, but the pain can be in a completely different location. So it's always important to know where this pain's coming from. So first we're gonna rock the leg back and forth. This is called a log roll. And so this is helping us to know if the pain's coming from the hip joint. Next, we're gonna lift up the leg. This is called a straight leg raise. Sometimes this will be positive with shooting pain down the back of the leg if they have a pinched nerve in their back. As we start to do range of motion of the hip by doing internal rotation, external rotation, flexion, we can also combine this with other maneuvers such as the scour when we're pressing down and internally rotating the hip. This puts pressure in the hip joint, letting us know if the pain may be coming from the joint. We also do external rotation and abduction. This is called the Faber test. This helps us know if this could be a pelvic issue or if the pain may be coming from the sacroiliac joint. We also can do an AP thigh thrust at this point, which can also help us know if this may be coming from that sacroiliac joint. Finally, we're gonna have the patient keep their leg extended while I'm pushing down. If they have pain in their groin during this maneuver, which is called the Stinchfield maneuver, then the pain may also be coming from the hip joint. So depending if the patient has pain with any of these exam maneuvers helps me decide if I need to do additional exam testing. So this was an example of how I do a typical screen when a patient comes in with low back or leg pain, so that I can best figure out where this pain's coming from and give the best recommendations on how to treat this so the patient can get back to doing what they love to do. If you want more medical videos like this one, I've got one right here. And I'll see you guys next week.